So I think we should proceed on and ask Kelly Francis to talk to us a bit about exercise as a way to augment supportive care of treatment and stress in follow-up of Chris's earlier talk and related perhaps to our last talk with Lainey Francis as well. Kelly.
Thank you so much, Dr. Kirkwood. I think the question that was just asked about fatigue with the patient on the BRAF MEK inhibitors kind of segues nicely into the presentation I'm about to give. So my name is Kelly Francis. I am a PA in the Melanoma Center, UPMC. I work mostly with Dr. Yana Najjar. And let me share my screen and we'll be, okay. So exercise for cancer fatigue. In my clinic, it's definitely one of the most common complaints that we see is fatigue. And this really is the most common cancer-related complaint across all cancer types, not just melanoma. So let's start with the definition here. Cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and cognitive tiredness or exhaustion related to cancer or cancer treatments that is not proportional to the recent activity and is interfering with the usual functioning. So we see about 50% of patients who are undergoing cancer treatment or have received cancer treatment in the past report fatigue as a distressing side effect. It's the most commonly reported side effect amongst all cancer patients. The prevalence of this increases to 75% for patients who have metastatic disease. And even 29% of people who have completed therapy can report fatigue as a disruptive symptom even years after treatment. So today, I'm going to briefly touch on some non-pharmacologic interventions that can hopefully help with fatigue related to cancer treatment, and improve quality of life. So for some contributing factors, one of the proposed mechanisms for cancer-causing fatigue is the pro-inflammatory cytokines, and cancer is an inflammatory condition, so increasing these cytokines can induce fatigue. However, it's rarely an isolated symptom. So it's important to, like Dr. Kirkwood and Melissa were saying, be evaluated by your medical team for secondary causes and to have a really multidisciplinary approach to treatment. This is very important for patients who are on immunotherapy, on targeted therapy, like that patient who had asked a question about their fatigue, because new onset of fatigue or worsening of fatigue could be a side effect of a different problem caused by treatment. So it's always important to discuss these symptoms with your providers. Like we talked about, the immunotherapy and targeted therapy, one of the most common side effects that are reported in all the trials that are done with these treatments is fatigue. But there are some things that can happen with the treatments, such as endocrine dysfunction, hypothyroidism, adrenal deficiency, things like that, that can contribute to fatigue. Anemia on your lab work cause fatigue, nutritional deficits, electrolyte abnormalities. These are all things that could contribute to why you're feeling more fatigued. Pain causes fatigue. Emotional distress can cause fatigue. After surgery, when you're deconditioned, you're not working out or you're not as active as you'd been before, you decondition pretty quickly, and that can lead to some fatigue as well. The medications that we're using to help negate some of the side effects that you're having from treatment, things that we're using to help with pain or nausea or even itching, these things can all cause fatigue as well. So it's really important to discuss this with your team, go over every medication you're taking, go over your labs, and kind of see if there's other things that can be intervened upon to help with your fatigue. One of the non-pharmacologic things that we can do that is very effective is exercise to help with fatigue management. So the NCCN, or the National Comprehensive Cancer Network, labels this as a Category 1 recommendation. And so what that means is that there is high levels of evidence and a general consensus across all people that this is a very effective treatment for patients and should be considered as part of their treatment regimen. Exercise has been proven in many, many studies to be beneficial in lowering fatigue and improving quality of life in all cancer patients and throughout the continuum. So when they're starting treatment, when they're on treatment, and even after they've completed treatment. So how do we get started? I think it's very important to have more resources available to you. So adding more people to your treatment team, like physical therapy and occupational therapy, to help augment the treatment that you're getting for your cancer, helps you to have a better quality of life and to be able to hopefully tolerate these treatments better. So before you start, you should obviously talk to your healthcare providers, make sure this is something that is safe for you, assess your level of conditioning, and hopefully meet with a physical therapist, occupational therapist, and develop a plan that can be sustainable for you, where you can start with some low intensity, short duration, and then increase that intensity and duration as you increase your endurance. There's no set guidelines that are recommended for how much activity or what types of activity are most beneficial, but in majority of the studies that I looked at, they recommend both cardiovascular and resistance training, and these really helped with combating fatigue related to cancer and related to cancer treatment. So these exercise programs should really be individualized based on the patient's performance status, what are their comorbidities, what is their fitness level coming into treatment, and what is a realistic goal and expectation. And I think it's very important to set goals that are manageable and hopefully reach those goals and then establish new goals. A general recommendation for all adults from the Surgeon General is 150 minutes of moderate intensity aerobic exercise per week. But of course, this is something that needs to be individualized based on how a patient is doing. Another non-pharmacologic intervention is energy conservation. And I think this goes hand in hand with developing a good exercise program. And so I think our occupational therapy colleagues are really important in helping you develop strategies to conserve energy, and which can help you build up strength and then take part in the daily activities that you need to do, and most importantly, the things that you want to do. So here are 4 Ps that are kind of a rough guideline of things to be thinking about so that you can spend less time on the things you feel you have to do and you are able to do things that you want to do, and being able to enjoy the aspects of your life that you want to be doing. So one thing is to prioritize, so figure out what's important, what needs to be done, and what can maybe be put off to another time, another day. Planning your activities, so if you're going shopping, you don't have to do extra trips later on in the week or later on in the day. Planning on alternating your heavy and your light tasks so that you have time to rest. Plan ahead of time for things that maybe could be delegated to friends or family. Maintaining a slow pace and resting often is very important. You may need to rest even before you start to feel tired. That way you can continue to have your endurance throughout the day. There are some breathing techniques that can be beneficial in conserving your energy and making you feel better as you're doing whatever the task is that you're doing that day. And then position. This is where I think it's really helpful to have the occupational therapists involved. Bending and reaching can really cause you to fatigue even quicker. So using some adaptive equipment or equipment that can hopefully be labor saving can conserve your energy and help you to maybe be able to do an exercise later on or have more improved quality of life while you're on these treatments. And so just in conclusion, physical activity has been shown to improve cancer-related fatigue. It also improves mood and it can improve treatment tolerance. So if you're feeling better, you can obviously tolerate the treatments that we're giving you much better. I think it's really beneficial to talk to your providers about what you're experiencing. I know everyone experiences some level of fatigue and we sometimes write it off, but it's really important to talk to your providers so that they know what you're going through, and maybe even getting some more experts on the team, like physical therapy, occupational therapy, doing additional workup with labs and things like that, so that hopefully we can identify any secondary causes and then make you feel as good as you can while you're going through these treatments.